We're going to go ahead and get started today. I want to thank everybody for attending this event. It's been a while since we've had a chance to talk. We really believe that open communication is critical, and we always have room for improvement. So if there's suggestions, please feel free to share those. Thanks again for joining us. Some of you are on video and can see the slides that we have. Some are not. So I'll be referencing some slides and trying to be mindful of the fact that you might just be on the phone. And the other thing I wanted to do is our goal is to make this a little more interactive, but Zoom is not allowing this to be done in a way that that it facilitates a large meeting like this. So what we will report today is really on things of questions that have been submitted by families over the course of the last few weeks. And so a lot of the content today will be designed to answer those questions that have been submitted. So anytime you have a question, please reach out, drop some questions our way, and they all make them to me, and then I have the chance to address them here tonight. So hopefully this format works for everybody. Thank you again for joining. And Tanya, if you do me a favor and flip the page, that'd be great. First up, I just want to take time to recognize our direct support professionals. This is the frontline team that really makes it happen in terms of the care that we provide. And we've done a lot of things in terms of trying to hold them up. The Lifescape Heroes that you see, these signs were posted all over. This happens to be Direct Support Professional Week, recognized federally throughout the United States. And Governor Noem was kind enough to make a proclamation. The proclamation's over to the left. If you're interested in it, we can get you a copy of it. It's kind of small to read. But I do want to read a couple of things that Governor Noem said in a press release for the direct support providers. The DSP Recognition Week highlights the efforts of those who work closely with individuals with intellectual and developmental disabilities. Many South Dakotans with intellectual and developmental disabilities rely on DSPs to deliver their individualized support services and help them achieve their goals. The state recognizes the valuable work carried out every day by dedicated and skilled DSPs who are the backbone of the quality service delivery for South Dakotans with intellectual and developmental disabilities. So just wanted to share that with you as part of what Christy was kind enough to do for our our DSPs. And what I would ask, if you get a chance and you end up talking to some of the DSPs, the CSSs, our staff, and we obviously always have room for improvement, but if you see something going well and they're doing some good things for you and your family and the people we support, would you do me a favor, write them a nice little note, send them an email, give them a call, give them a pat on the back. It's been a tough few weeks with COVID, or number of weeks with COVID, and anything we can do to hold these people up for all the good work that they do is incredibly appreciated. So if you wouldn't mind being able to do that, it'd be much appreciated. Up next, Tanya. We're going to go through a lot of updates today, and I'll just walk you through a number of them. And again, recognizing a lot of people are on the phone. In terms of COVID, the results through the summer have actually been better than we expected. We saw a fairly significant decline in positive numbers, and I'll share those with you in just a minute. So we've actually had some pretty good results. It's really based on all the work that we've done to put in place to protect those that we serve. Our last positive for any person supported was in late May, and we're pretty excited about that. That's we actually had anticipated possibly up to 30 individuals in any one given time having COVID, based on some stats that the state of South Dakota shared with us, and to be not have positives since late May, we're feeling very good about. So we thank everybody for the support that you've given us to this point, that has shown that all the good work and the efforts that we've done have proved to be positive on that end. And we're just pretty excited about those stats. Obviously, going into the fall, Sioux Falls itself, as well as the state, is seeing uptick in positive numbers. Obviously, with school opening up, with universities opening up, different large events going on, those kinds of things, we kind of anticipated the numbers would go up. We are seeing hospitalizations move up, but they're moving at a much slower rate than the positives. And with that, that leaves a lot of capacity in the beds. At the end of the day, all the work and effort that's going on is really dedicated trying to preserve those beds in those hospitals. So those individuals, particularly individuals we serve that have a higher risk, have an ability to utilize those beds, and the beds aren't all taken up by others. So the good news is we've been able to manage the capacity to a point where still a lot of capacity in the hospitals, and we view that as a good thing, even though the numbers are ticking up. We have seen the advent of visits coming back, schools opening, our school opening, and some day programs starting to progress forward. I know that's a big question for a lot of you. Day programs are something that we've been working on. We know that a few of the CSPs had decided to go ahead and reopen their day programs. I know of two specifically in the region who not only opened in a week, but they closed in the same week due to COVID concerns. Unfortunately, there was a fairly substantial spread of COVID within those areas. And so we're stepping back, working with Department of Health, trying to figure out how we could move forward for day programs and what that might look like as we go forward. The two adult COVID positive care sites, I don't know if you remember, but in our last presentation, we have one site up on North Louise and then one site down at Western. Those were designed to accommodate almost those 30 individuals we had anticipated as being positive. Something that's fairly unique both to CSPs as well as nursing homes and supported care types of facilities is that we actually have two very separate areas where individuals who test positive for COVID are being treated and supported. And they've been removed from the home. They've been removed from the residential area, and they're actually cared for at a different site. This is very unique to the care that LifeScape brings. It's something that the Department of Health is suggesting for everyone. It's just really tough for a lot of organizations to find a different location to host this type of care. And so the good news is not only do we have no COVID with person supported since late May, because of that, we've been able to shut these two facilities down, redeploy the staff until they're needed. And so at this point in time, we're 0% utilization of those care sites. Residential facilities continue to vary in their phase. We have 1 through 5, 5 being back to normal, 1 being the tightest restrictions that we have. And all our residential facilities are in a phase 1, 2, or 3. Please know that each of these facilities is based upon the actual presence of COVID, whether that be in the staff or in the person supported. Also taken into account from a phase perspective is staffing capability. I'll talk a little bit more about that, but staff have their own lives at home. They have their kids going to school, those kinds of things. And we see a major reduction in staffing availability because of potential issues with COVID and staff. And then I want to remind everyone, we're working hard to ensure that some form of visitation, regardless of what the resident's phase is going to be available for families. I won't tell you that it will be often and it'll be easy to do, and it may even be in a different facility. But I've challenged our operations team to make sure that regardless of what phase we're in, we have some ability to host visitations. Again, it may not be as often as you would like, it may not be as convenient, it may not even be in the same building. We're just trying to work through that with Department of Health and what that would look like. But clearly going into the fall and the idea it could be quite a while under a phase 1 in certain instances, we want to make sure that family visitations are made possible. Next slide. Again, keeping in mind, we have a number of people that are on the phone today. What I'm looking at next is our statistics. And this is the statistics for for what we see with COVID. And I'll remind everybody a couple of times, we will post on our website the link to this meeting. So if you could only be on the phone today, but you could go back and watch it by video later, we will have that available. If you have to leave partway through, you can catch up and look at the video. Or if you just don't have time to finish watching this, the availability of this video will be posted on the website. Back to the statistics. In terms of tested, we have tested just under 500 staff and persons supported since COVID came into play. With that understanding, we have 1,100 staff and almost 500 persons supported, being children and adults. Just to give you an order of magnitude, of that 1,100 staff and of that 500 persons supported, we did have 58 staff test positive as of yesterday for the time period of COVID back to March. And we have had 26 persons supported test positive, one of those being children, 25 being adults. As of today, we have 3 active cases, and that's 1 staff in the children's area and 2 staff in the adults area. We have 2 staff with pending tests, so they could come back positive. And unfortunately, a reminder that we have had 2 adults supported that have passed due to COVID. So I think the takeaway is that if you would look back at some of the early numbers, we're really not that much further ahead than the last time we reported. And again, that's been because we've been able to really get this under control through utilization of all the different protocols that we have in place. So we'll move to the next page. So what are those protocols? Well, the protocols, just a reminder of the different protocols. We have screening in place in all residences and all facilities, including our outpatient. We are looking at automating some of that screening. So as you walk underneath a temperature monitor, it automatically tells if you're pass or go. We have the restricted points of entry in virtually all the facilities. Universal masking requirements continue to remain. PPE deployment is appropriate based on the phase. The children's area just went back, took a step back, and we went to face shields as opposed to the goggles. And so each residential unit will have different deployment based on those phases of PPE, masking requirements, et cetera. Just know masking requirements are pretty standard and throughout the system, probably until we get to phase 5. We have the heightened infection control practices, including fogging. We have a couple of the fogging guns, and particularly in those areas where COVID testing has been required, we'll go in and fog those units with a special disinfectant that's designed to kill COVID. We continue to do increased training, both in terms of why PPE, why the masking, why all the reasons that we're doing this. We think it's critically important. We continue to have that separation area for COVID, both in the children's as well in the adults. Again, good news is we don't have to use it as of today. And then we remain in constant contact with the Department of Health. Department of Health calls are virtually every day. Department of Human Services are every week, and then we continue to get guidance from Sanford, Avera, and others on best practices as we go forward. So those are just some of the protocols that we're looking at. The next piece, and so some of that was in answer to questions that have been presented. There's a lot of questions on this balance of safe environment versus quality of life. And so I wanted to take a minute to talk through it, talk candidly through it. And so as we look at this, and this is particularly to congregate living. So some of our homes have maybe only one person in an apartment. Those individuals have the ability to live on their own in a better way than some of our other individuals. As we get into really congregate living, where people are living 3 at home, 4 at home, 5 at home or more, this really comes into play. And so as we look at congregate living and balancing safe environment versus quality of life, just some things we want to point out. And the first one is, you see there's a little bit of an imbalance here. And I say that because we are conservatively leaning towards providing a safe environment. I will tell you that that becomes first and foremost in everything we do. And then we try to balance it out with quality of life. Why do we have conservative leaning? Well, one, there's this ever-changing CDC, Department of Health, DHS guidelines. And you've probably seen, is the president influencing CDC rules, looking at FDA rules, all those kinds of things. We're seeing these rules change all the time. And so our best defense is to be in line with what CDC and DOH suggest. And as they're changing, we're changing. But nationally, what we're seeing is that over 40% of all COVID deaths are people supported through nursing homes, assisted living, and congregate living. And so what you see is that there's a predominance there. And the predominance has something to do with the congregate living, particularly due to the infectious rate that this particular virus has. But it also has something to do with the underlying medical conditions of those in nursing homes, assisted living, and these congregate living areas. 22 states show that over 50% of the deaths are associated with individuals that get this type of support. And unfortunately, Minnesota and Rhode Island are showing that 80% of their deaths are related to places with congregate living. The state of New York, Governor Cuomo produced a report a couple weeks ago, and one of the stats that he showed was that people with disabilities are 2.5 times more likely to die from COVID than others, and that's predominantly not due to the disability itself, but the underlying health issues that those individuals with disabilities may have. So when you take all of these stats, what the government's really starting to see is that if they have a place to influence the rate of death, it really belongs in this congregate setting, nursing homes, assisted living. And that's where they're really putting their efforts in terms of guidance. And as they establish the guidance, particularly for these types of areas, particularly nursing homes, what we're seeing is the state then is taking those learnings and applying it to ICF children, to residential adult care that they have oversight on. And so what we're seeing is that not only are the rules changing at the federal level, but then the state does interpretation of that and then gives us guidance. And we've got much more guidance now than we have certainly on the onset, March and April. I would tend to believe we were kind of on the off the radar of the state, if you will, where we're now more on the radar simply because of all the conversations we're having with them. So please understand, as we look at this, the safe environment is really primarily a priority and a primary goal of everything we do, whether it's protocols, those kinds of things. And so do we lean heavily towards it? We absolutely do. Now, if you go to the next page, I will tell you quality of life does matter to us. And we're working hard to figure out how exactly to create quality of life. And I would challenge anyone that's listening today, even with their own independence, that their quality of life has changed. COVID has done that to virtually everybody. People staying home, being more isolated, the psychology and the detriments that come with it. We see it in our own homes. We see it in other places. We want to avoid it as much as possible. And so when we think about it, what can we do as we have different phases in different residential areas? What have we been able to do? And what I want to do is just run through a list of things that we are doing now. For those that are on the phone, what you won't see on the screen is a picture of some of the various events that we've been holding. But I thought it was really important that we explain to the families that it is a goal, maybe not quite as hefty goal as safe environment, but it is a goal that we've continued to work on. So I just want to walk through some of the examples that we have here. And so first up, gardening. So a lot of our teams are doing gardening, but also then parlaying that into doing homemade foods, salsas, doing, pulling carrots and making them for dinner that night, and trying to do some education around that. We're very excited because of the way we isolate the residential. The residents in the residence live like they would live like a family would, not really isolated. And then the staff that support that residence are the only staff that support that residence. We don't rotate 1,100 people through that home. So as we have what we call a cohort, it's a group of people that really hang together through the COVID environment. We realized we could start moving those individuals out to safe places as a family. So a small residence of 3, maybe a larger residence of 5 or 6, maybe some of the kids residential, those kinds of things, they go out as a team. And what we're able to do is start up the Trent Farm visits again. And we've made sure that we keep it socially distanced. The good news is you get to be outside. And so some of the pictures that you see here with the tractors and the cattle and some of the feeding and different things we do, if they're able to social distance, it just works out great. We're doing it outside. And by the way, it's only that home, excuse me, going to Trent Farm that day. And so we believe that to be a safe environment. It gets everybody out of the house, gets them into a nice outside environment. We're pretty excited that we can do that with Trent Farms. If you get a chance to say thank you to them, that group of people, please do. We also do spa days, again, within the setting. And so some of the homes have qualified for this, some haven't because of COVID concerns. The spa days allow the individuals to get their hair done, men and women to get their haircuts, nails done, things like that. We're utilizing a couple of the rooms over in Western as appropriate, mainly a chance to kind of get out of the house and do some things with smart boards and things like that. We're doing we have found that a lot of the day services at homes have been very successful with the folks as we've talked to them. They've looked at this being a positive move. Not saying everybody thinks it's positive, but a number have. And then another one just want to say is that we've been able to start doing home visits. And so I know there's a number of adults and some children that have been able to go home for the weekend. If that's something you're interested in, I would ask that you reach out to our folks and talk about what that might look like. Again, it depends on what phase they're in. As you get closer to phase 1, the ability to do those home visits becomes limited. As you get closer to phase 3, those become options that are available. Additional things that we're looking at for quality of life. Next page, Tanya. Drives to Fall Park and other parks. We've been utilizing the parks heavily this year. It's a great opportunity to get out there, isolate, being out in nature, and doing some social distancing. So that becomes one we're doing a lot of. Hats off to the foundation. They've paid for a lot of different games and equipment. As the homes have asked for different things to create entertainment in the venues, whether that's getting people to donate things. The foundation's just been spectacular in that. One of them was a giant Connect 4 beanbag opportunity, footballs, different things like that. And so hats off to our foundation for helping improve the quality of life for these individuals. We have walking clubs and exercise groups. And again, those are the small cohorts of individuals we're trying to encourage. We don't really want people just sitting watching TV every day. And if we can encourage them to do different things, we definitely want to do that. We are Zooming with other homes. So the communication, I've been in a couple of those with transition kids where you get a chance to talk to them and they're talking to others in other homes. And it's with an opportunity for them to be together like a normal day service. They're doing video games and virtual zoo visits and those kinds of things. Then lastly, exploring and learning about the world online, trying to make it more educational. Some of them have gone so far as to plan their next vacation online. So they kind of have an itinerary and different things like that they're putting together. And then the last page on the quality, Going out to eat, still doing that. A lot of times it's just basically going out to pick up the order, but some restaurants are doing some nice social distancing or have picnic tables, things like that, that we can work with. Virtual bingo has been a fairly big event. We staff that with volunteers, and that's coordinated through the foundation, and they can do virtual bingo. Has been a big opportunity for individuals. Still hosting community room movies, sports, popcorn. Got to see the Vikings play over the weekend, that kind of thing. Whether you're a fan or not, kind of depended on the outcome that you received. Assisting with daily living skills, focused on continuing to do that, reinforcement. Catching up on medical appointments and healthcare priorities has been a big one. Obviously, we postponed a lot of those medical visits over COVID. There's been a lot of work done by the hospitals and different therapies and that kind of thing, where we feel much more comfortable going back to those environments and getting caught up on some well-needed medical appointments and visits. Obviously doing group picnics, and then the last one I thought was pretty neat, motorcycle parade. For those of you that might have the screen up, you look down to the bottom left, you'll see that quite a few of those that support LifeScape, both in adult and children, have come out to try to encourage everybody and get a chance to talk to them as they go by. Again, more social opportunities. So the last one, next page, this was kind of neat. We challenged some Augie individuals to come over, and they wanted to help in a way that they could. And we have a number of these window wells, and they're fairly big at the school. And what the kids in the school look out and see is cement. And the suggestion was, let's paint those cement walls with different pictures. You'll see the one in the middle, kind of a seascape, if you will. Birds on the left side and some other art. And the Augustana people came in and created that. So as our kids are in school, they're not looking just at cement walls. They're able to see something a little different, more artistic. So hopefully you'll see that we've done a lot of work to try to balance out the life, the quality of life from the safety of life. And we certainly welcome other suggestions that you might have on things that we can do. Please understand that some of these things have been allowed in certain residential areas, while it hasn't been allowed in other residential areas. That's because of where COVID's at. We might have had staff testing positive, maybe an adult or a child testing positive, and we have to put that into lockdown to make sure we've got that under control. So with that, please know we understand the challenges of life balance, and I'm hoping that you can see that we've given it some good effort. Again, we are open to suggestions should you have any thoughts on how we can improve that. The next one up, I just want to talk a little bit. I'm sure you've heard of testing, particularly nursing homes, a lot of conversation around testing of nursing homes. And basically, we've gone through the front end of testing, and we're now into a couple different types of testing, depending on the residents and the particular issues going on at that point in time. So the state has set up a couple protocols, and they're still working through what it looks like. As we learn more, we're happy to share with you. But again, like I said, nursing homes were directed federally, as was assisted living. And now the states are identifying that whether it's an ICF for the children or a residential unit for the adult, really does need some protocols around testing, and they're just evolving now. But I'll share with you a thing called point prevalence testing. The easiest way to think about it is hotspot. So we have a hotspot. We think we have some individuals, whether that be staff or person supported, that have tested positive for COVID. And we want to know just how prevalent that is within the residents, within the children's hall, that kind of thing. We can call in the Department of Health, and they'll do a mass testing for that subset of individuals. So it might be a 4-person test plus staff at a residential. It might be a bigger one like we just did at the children's. And good news is we got the test back yesterday and everybody came back negative. We thought we might have some prevalence of COVID in the children's area, and the good news is we proved that we didn't. So that becomes hotspot testing or point prevalence testing. Additionally, we have sentinel testing, and what that is really just a random test, trying to see if we could pick up on somebody who probably is positive, but probably not showing symptoms. And if we can do that and catch that on an early testing, we can stop some of the advancement of COVID testing or COVID infections in that particular area. And so as we're still working through the protocols, how many people, how many subsets are included in those protocols, just know that we've agreed we're going to go ahead and move forward with sentinel testing. We don't know exactly what it's going to look like, but the good news is we will be there. You know, eventually, hopefully, there's an easier test that everybody can take on a periodic basis that allows us to really know where we're sitting. But for now, sentinel testing is the closest we can come. Next up is communication. Like I said on the front end, communication, I believe, is incredibly important. We want to be transparent. I will tell you there's always opportunities for improvement. As you go through the chains and the protocols of communication, things can get lost, can get misunderstood, dates can get transposed, all sorts of good things. And so I'll be the first to tell you, I know we got to get our communication act better. But I hope that what you are experiencing is good communication that can improve. Please know any communication that you have, if you would reach out to our case managers or program coordinators or CSSs, they've all been instructed to capture that information and make sure our supervisors are aware of the questions that you have. And to the extent that these become bigger questions, they make their way up through our senior leaders and up to myself. And so if you do sense some issues with communication, please let us know. It is critical from my perspective that we have open and transparent communication. Okay, next up. Giving you a lot of information today. Again, we'll have this posted at the website so you can review it. I want to take just a few minutes to talk about a legislative initiative that I'm involved in. The letter that you see on the left, for those of you that aren't on video, you won't see this, but it's a letter to the governor, which was sent out in early September. It was signed by every director and every CEO of every CSP in South Dakota. That's 19 CSPs representing about 4,500 adults, and as well as our children's ICF. We all signed this, and what we're asking for is better funding, particularly to support a wage increase for all our direct support providers and our frontline staff. And why is that important? Well, right now, based on the funding that we get, LifeScape starts at $12.50 an hour. Our average DSP makes $15.09 an hour. For a lot of old people like me, that might sound like a lot, but I want to put it in perspective. As of today, Target since July 1st is paying $15 an hour starting. Walmart will be there by December 31st. Hobby Lobby just announced this morning that they are starting people at $17 an hour. We have Amazon coming in, opening up over 1,000 jobs starting at $15 an hour. And so what we see is a continued gap of funding that creates a gap in terms of competitive pay. And when we don't have competitive pay, we end up losing good people. For those of you that have supported sons and daughters, everyone knows somebody who knows that person better over the course of 5 or 10 years will do everything they can to avoid triggers, to make life much more, make it better for the individual supported. Continuity of care is critical in what we do. And you can't have continuity of care when you have 40% turnover. It just doesn't work that way. Why do we have 40% turnover? Because we have a lack of funding from the South Dakota state, the governor and the legislature, because they haven't kept up with the increasing competitive wages. It's something I've talked to the legislature till I'm blue in the face over the last 2 years. I've spent a lot of time in Pierre, and I wanted to get in front of this year. So I wanted the governor to know we're coming asking her for $32 million. $32 million equates to a $3 an hour raise for every one of the support people at LifeScape, as well as the other CSPs. And I think it's absolutely critical that we get support from the governor, which we have not heard back from, by the way. It's 15 days later. We haven't heard a response back from the governor, but we also need the legislature to support it as well. We believe the funding is available. We just have to make it the priority as we go forward. And it becomes critical in a bigger way. I told you early on that our staff personally get affected by COVID. Well, I want to give you a couple of stats. Remember, we have 1,100 staff at any given time at LifeScape. As of yesterday, 340 staff have been impacted by COVID, whether that is because they themselves became positive or they were exposed to somebody who was positive. And when they're exposed, they have to stand down for up to 10 days. When they're positive, they have to stand down for up to 10 days. And the total, so some staff have been exposed more than once. So they actually have to stand down again. That becomes problematic for the staff. Again, low wages to begin with, but now they're eating up their vacation or their sick time, or they may not even be paid because they can't come to work. So obviously that doesn't help our workforce. But also what it does, it creates a challenge. With 1,100 staff, we had a number of people available for those issues where people become sick, issues where they have a death in the family, all those kinds of things. We had backup. Well, 340 staff had some relation to COVID, and it took them out 2,598 days that they were not able to work for LifeScape because they had to isolate or they had to stand down because they were positive. So with that, that creates a huge labor force crunch. And it's the unintended consequences of COVID that affect everyone. I mean, we all have it. If you have sons and daughters in school, you have sons and daughters in college, if you're working at a grocery store, it happens to all of us. But that impact eliminated 1/3 of our staff at any given time to provide the support that they need to support. So what's that mean? That means the existing staff have to work twice as hard. That's why it's so important that we'd ask that you'd recognize the DSPs this week and say thank you, because most of them are pulling double time. And it's just really a tough place to be. And I'm not trying to create excuses here, but I do want to let you know this is my voice that we're representing to the governor. It's my voice I'm representing to the legislators, but I'm also asking you to be your voice. One voice can be loud, but not loud enough to make this happen. Many voices will give us a good shot at getting the funding we need so we can increase the wages for those people that are taking care of your son or daughter. And the reason I say this is if you're interested, we're asking you to reach out to Tanya. For those on the phone, this will be available, but it's Tanya's email. And we're trying to accumulate a database of people that would be willing to advocate, whether to the legislature, to the governor, on behalf of this need. And I'm happy to write some text that you could just copy and paste, to give you some bullet points to talk to, those kinds of things. But it's really your voice that matters more than my voice in making this happen. And so I would ask if that is something you are interested in. We have had some people reach out and say that they'd be willing to advocate. And we just ask that if it's something you're interested in, we'd like to create a list and then be able to help guide you on the ways to be able to create this voice up at INPEER. So with that, I've got one more topic, and that's on influenza immunizations. Throughout the United States, certainly throughout Sioux Falls, throughout the medical community, there is a huge push to get everyone immunized for influenza this year. It's simply driven by we're trying to preserve those beds for people that have high risk with COVID. And if those beds start filling with influenza patients, that's one less bed available for a COVID patient. And we see this as a prime directive. And based on that, we're changing our immunization policy that all LifeScape staff will be required to be immunized for influenza. There are some exceptions to it, which require masks and some other protocols, but the vast majority of our LifeScape staff will be immunized. And so with that, we know that comes a lot of questions on safety. Does it really reduce symptoms? Does it reduce the duration? Those kinds of things. And we wanted to address that. And so with that, we asked Dr. Patty Peters to join us for an informal conversation on why people should consider immunizations this year. And she does a really good job of it. She's done 37 years at the McGreevy Clinic. She's been on our board. She's been a health advisor for years, a person who's well-known, well-liked, and well-respected. So we're going to play this video for you. You can stay on if you'd like to learn more about it. Highly suggest just for yourselves, you consider the immunization. Obviously, if you're visiting your son or daughter, we think it's pretty important that you're immunized. We think it's important that your son or daughter is immunized. Again, all to protect those beds, so we have some beds for these people who may come down with COVID and are on the higher end of risk with that. So with that, I'm going to flip this over to this video. But before I do that, I want to say thank you to each and every one of you. We've gotten some really good comments of the work that we do. We thank you for that. We also like to hear, the downside, and we've heard some individuals with some true concerns, and they've been kind enough to express them in very professional ways. And I will assure you, anybody that sends in any concerns, we do want to get back to you. And so a lot of those end up making them to me. A lot of the content today was based on those comments and questions that were forwarded over the last couple of months. So again, thank you for allowing us to support your son and daughter. And we look forward to communications as we go forward. I'll turn it over to the video now with Dr. Patty Peters on influenza immunizations. Thank you.
Good morning. Steve Watkins, CEO of LifeScape here, and we've made a decision that we're going to ask all of LifeScape to go ahead and take part in the influenza immunization this year. You probably heard a little bit about it from Mayor Paul as well as the Sanford Navarra team, and the goal really is to try to keep the beds open for care of COVID patients. And when you take the immunization, there's a chance that one, you may not get it, and two, if you do get it, obviously it could be a lot less severe, keeping those beds open. So that really is the goal. And so as we work our way through it, your supervisors will be able to get you a little more information on it. We still have some of the opportunities through whether it's a religious issue, maybe a medical issue, those kinds of things to work through. So I just ask that you talk to your supervisor if you have any questions. But we also thought it'd be a good opportunity to bring somebody in who really understands why we're doing this. And today I'd like to introduce you to Dr. Peters. Dr. Peters just shared with me that she has 37 years with the McGreevy Clinic. Congratulations.
Thank you.
And this is her first day of retirement, and she's spending it with the LifeScape team. So along with that, Dr. Peters has been a board member since 2006, a family practitioner. And I do want to read off just a few lists of the professional organizations so you understand the credibility that she brings as not only a board member, but an advisor, particularly on this issue. First up, the American Academy of Family Physicians, the American Board of Family Practice, the Avera Health Board of Directors, the South Dakota Perinatal Association Board of Directors, Education Committee of the South Dakota Academy of Family Practice, the Center for Family Medicine Board of Director, Prairie Rehabilitation Services Medical Director, Avera Health Mission and Strategic Planning Committee, to name a few. I didn't read them all off, but I also know she does some medical missions throughout the world as well. And we're just so blessed to have somebody with that caliber of background able to talk to us about today about how important influenza immunization is. So I'm going to be quiet now and let you hear from somebody who knows what's going on. And we just ask that you take a listen to what Dr. Peters has to say. We are actually going to share this with the LifeScape families as well as the LifeScape staff. So
Okay.
thank you for joining us today.
Sure thing. Thank you very much, Steve. And I have on my mask, but in order for you to understand me a little bit better, I'm going to take it off. But I am here to still encourage you to wear masks, and I know that you need to do that when you're at work, but I really, really encourage you to wear the mask when you're out and about and around crowds, because we don't want you to get COVID, and certainly this can help protect you too from influenza. So still remember, wear the mask and wash your hands. So I will now remove it. Hopefully you can hear me a little bit better now that it's off, okay? So yes, I agree that doing the influenza vaccine is very important, and I hope that all of you will take advantage of it, and I'm assuming it will be given here, Steve? Is that
Yes,
the-
yes, we'll have various areas to be able to get the shots and set up the schedules and the times. All that's coming.
Okay,
Yep.
yeah, that's very good. So it's very helpful when you can do it at your place of employment. And I know most people don't like to get poked. I don't really like to get poked. Today I got one of my immunizations, but it's very important. And over the years, I've certainly seen people with influenza, and influenza can make you feel really, really sick. And personally, I've had influenza way back in the day before we had immunizations, and I had to stay in bed at least a week. I had a fever of 102 and 103, and I developed influenza during the winter, probably January, February, and then I coughed until July. I thought I would never get over that cough. And I just say, well, the July heat must have burned it out of me. But it was definitely not a very good thing to be sick with influenza, plus the lingering effects of it. And some people end up in the hospital because of influenza pneumonia. Sometimes you get a bacterial pneumonia on top of it, which makes you still sicker. You need antibiotics, you need to be home, or unfortunately maybe in the hospital because you need extra support such as oxygen or respiratory therapy. So all in all, influenza is not very nice. Thankfully, we do have one or two medicines we can give to people if we find out about it soon enough to give it to them, so maybe the influenza doesn't get as strong in their body or last as long. But you never know. Medicines aren't always perfect. So the one thing that we can certainly do ahead is this one shot. Doesn't hurt too bad. If you want to take some Tylenol after the shot in case you think you might feel a little feverish, there's nothing wrong with that. But I highly encourage you to get the immunization. And the other thing is, if you would get influenza, you might be working before you ever know you truly
Sure.
have it. Just like we talk about COVID, there could be some asymptomatic days when you're just maybe slightly under the weather or think you're catching a cold, and then 3 days later, kapow, you're sick, you got the high fever, and here you may have been spreading the influenza to others. So that's another wonderful reason to get it, and we sure don't want any of our children here or our adults that we take care of to get influenza. So hopefully everybody will get that immunization.
Can you speak to the safety of the shot? I know some people have concerns with the safety of the shot.
They're very safe. You know, over all these years that I've been doing medicine and giving immunizations, right now I can't even think of one at this time. You know, years and years ago, there were people who had trouble after the swine flu vaccine.
Mhm.
But in these last, I'd say 7, 8, 10 years, that has not happened. So I feel
Okay.
very, very safe. There should be no issues with taking the vaccine other than, like I said, maybe you run a little fever or feel a little under the weather. Some people feel like they get a little cold, but nobody should say that they're getting the flu from the flu vaccine.
Okay. And then how about the effectiveness? Sometimes you hear, well, I hear it's not effective, so I'm not going to do it.
Well, that's a very good question, Steve, because we know over the years sometimes the influenza vaccine doesn't cover as well because we actually picked the wrong form of the influenza that we think is coming, and we make the vaccine to the one they think is coming, and then the little virus changes its ways. So we do our best to figure out which influenza virus is going to be the one that hits our country and make a vaccine to that one. And when we pick it right, which is almost always the case, it takes care of people very well. Whether 60-70% coverage, but a lot, and it's something that we should be doing.
I've heard even if it doesn't prevent it, it minimizes the impact of,
Right.
of the flu.
That's right. Your body gets some immunity going so it can fight it off easier.
Okay. Well, anything else you'd like to share with us on the influenza? Whether what to do to stay away from it, hygiene, anything like that?
Yeah, well, that's right. So just like you're doing now for COVID-19, wear your mask and wash your hands a multitude of times a day. And we tell people if you're going to sneeze, you sneeze into your elbow, or if you do have a handkerchief, and then throw that away and wash your hands again. Cover your mouths if you cough, wash your hands. Certainly, if you feel like you're sick, whether you're running a fever or getting a significant sore throat or bad cough, you should be checked out. We do have testing for influenza, just like we do for COVID. And the influenza test comes back very quickly compared to right now how we're waiting for most COVID tests. So if you have at all any idea that you might have influenza, call your doctor. You can get checked very easily and find out right away. So be careful, stay home if you're sick, cover your coughs, wash your hands, get the immunization.
Excellent. Well, this team's probably heard that before, once or twice now. But obviously somebody who has a much better skill set than I do is now telling you the same thing. So thanks everybody. Thanks to the LifeScape family and everything you do for us. And thank you, Dr. Peters, and congratulations on your retirement.
Yes, thank you very much, Steve, and it's been a pleasure to visit with all of you. Take care and stay safe.